You wake up. It's early morning. Maybe the sunlight is just barely coming through the curtains, and the first thing you notice, before you even check your phone, before you think about your day, is that your mouth feels like you've been chewing on sawdust all night. Your tongue feels like sandpaper, your lips are dry and sticky, and you just think, I must have been breathing through my mouth again. So you drink some water, move on with your day, and forget about it entirely. But here's what I need you to hear right now, and please, stay with me on this. That dry mouth you're waking up with every single morning is not just a minor inconvenience. It is not just about sleeping with your mouth open. Your body is a remarkably intelligent system, and when something keeps happening every morning without fail, it is trying to tell you something. Something important. Something that, if you ignore it long enough, could quietly snowball into a much bigger health problem. Hi, I'm Dr. Elara, and welcome to the Dr. Elara Health Channel, where we take the signals your body sends you every single day and decode exactly what they mean, so you can take real, meaningful control of your health. And today, we are going deep on morning dry mouth, because almost everyone I talk to brushes this off as nothing, and almost everyone is wrong to do that. So let's start from the very beginning, because I want you to understand what's actually happening in your mouth and your body while you sleep. Your mouth is supposed to stay moist even while you're asleep. Saliva is not just something your mouth makes when you smell food. It is working around the clock, even at night, even when you're not eating. Saliva keeps your mouth tissues hydrated. It neutralizes acids, it fights bacteria, and it protects the enamel on your teeth. A healthy mouth produces somewhere between 1 and 2 liters of saliva every single day. At night, the production slows down naturally. That's normal. But if you're waking up with a mouth so dry it feels like a desert, that slowdown has gone way too far, and your body is not producing nearly enough saliva. The question is, why? And this is where things get really important, because there is not just one answer. There are several, and some of them are far more serious than others. Let's start with the one that affects millions of people and is almost completely overlooked: sleep apnea. Now, most people think sleep apnea is just about snoring, and yes, snoring is often a sign. But what sleep apnea actually is a condition where your airway partially or fully collapses during sleep, causing you to stop breathing, sometimes dozens or even hundreds of times per night. When that happens, your body does what it instinctively knows to do. It forces you to breathe through your mouth because your nose is not getting enough air through. And mouth breathing at night is one of the most direct causes of severe morning dry mouth. But here's why you should care about this beyond just the dry mouth. Sleep apnea means your body is being deprived of oxygen repeatedly through the night. It means your heart is under stress. It means your brain is not getting the deep, restorative sleep it desperately needs. People with untreated sleep apnea have significantly higher risks of high blood pressure, heart disease, stroke, type 2 diabetes, and even cognitive decline. So if you are waking up dry-mouthed and you also feel exhausted even after a full night of sleep, if your partner says you snore or gasps in your sleep, if you wake up with headaches, please, do not let another week go by without talking to your doctor. A sleep study can change your life. It genuinely can. Now, let's talk about something else that a startling number of people don't connect to dry mouth, and that is blood sugar. Specifically, uncontrolled or undiagnosed high blood sugar, which can be a warning sign of prediabetes or type 2 diabetes. When your blood glucose is too high, your kidneys go into overdrive, trying to flush out the excess sugar through your urine. That means you're urinating far more than usual, especially at night. And all that fluid leaving your body means you are becoming dehydrated, even if you drank plenty of water before bed. Dehydration means your salivary glands can't produce enough saliva, and you wake up with that familiar, sticky, dry feeling in your mouth. But it gets deeper than that. High blood sugar also directly affects the function of your salivary glands. Research has shown that people with diabetes often have lower saliva production rates and altered saliva composition, making them chronically prone to dry mouth. If your morning dry mouth comes paired with increased thirst throughout the day, frequent urination, unusual fatigue, blurred vision, or slow-healing cuts and bruises, these are warning signs that your blood sugar might be out of range. And I want to be very clear. You could have pre-diabetes or even early type 2 diabetes and feel perfectly fine otherwise. This is why dry mouth matters. It can be one of the earliest clues your body gives you that something is shifting in your metabolic health. Let's move on to something that is hiding in plain sight for so many people: your medications. If you are taking any prescription or over-the-counter medications, there is a genuinely high chance that one of them lists dry mouth as a side effect. And the list of medications that cause this is enormous. Antihistamines, the kind millions of people take for allergies or to help them sleep. Antidepressants, especially the older tricyclic types and many of the SSRIs. Blood pressure medications, including diuretics and beta blockers. Anti-anxiety medications. Bladder medications. Muscle relaxants. Even certain pain relievers. These medications interfere with the nerve signals that tell your salivary glands to produce saliva, and the effects can be especially pronounced at night when you're lying still for hours and not drinking water. If you've started a new medication recently and noticed your dry mouth getting worse, that connection is probably not a coincidence. You should never just stop taking a prescribed medication on your own, but absolutely bring this up with your doctor. There are often alternative medications, dosage adjustments, or strategies to manage this side effect that can make a real difference in your quality of life and your oral health. Now, I want to talk about something that doesn't get nearly enough attention in health conversations, and that is the relationship between chronic stress, anxiety, and dry mouth. When you are under stress, whether it's the kind that keeps you awake at night worrying, or the kind that has just become your permanent background noise because life is demanding, your nervous system is running in what we call sympathetic mode, or fight or flight mode. In this state, your body prioritizes survival functions. It diverts resources away from things like digestion and saliva production, because in a survival situation, making saliva is not exactly top priority. The problem is, so many people in the modern world are living in a chronic, low-grade stress state that never fully turns off. Their nervous system never fully shifts into the parasympathetic, rest and digest mode that allows the body to do its housekeeping functions properly, including producing adequate saliva. So if you are someone who goes to bed with a racing mind, who carries tension in their body, who wakes up already feeling anxious before the day has even started, your dry mouth may be your nervous system's way of showing you just how taxed it is. And addressing that stress is not just about feeling better emotionally, it is a genuine health intervention. Let's also talk about an autoimmune condition that specifically targets the glands responsible for moisture in your body, and that is Sjögren syndrome. This is a condition where the immune system mistakenly attacks the salivary glands and tear ducts, leading to chronic dry mouth and dry eyes. It's more common than most people realize. It predominantly affects women, and it is frequently underdiagnosed because the symptoms can be vague and gradual. If your dry mouth is persistent and severe, if your eyes also feel dry and irritated regularly, if you experience joint pain or unusual fatigue, Sjögren syndrome deserves to be on your radar. A rheumatologist can test for this, and getting a proper diagnosis opens the door to real treatment and management. I also want to talk briefly about something lifestyle-related that many people are doing every night without realizing the impact, and that is alcohol. Even moderate alcohol consumption in the evening acts as a diuretic, meaning it promotes fluid loss. It also suppresses the normal hormonal signals that regulate fluid balance during sleep. So you might feel relaxed and sleepy after a glass of wine, but by 2 or 3 in the morning, your body has been quietly losing hydration, and you wake up with a dry, stale-feeling mouth. Cannabis has a similar, and actually even more direct effect. It contains compounds that directly suppress saliva production, which is why dry mouth is one of the most consistently reported effects. And of course, smoking and tobacco use damage salivary gland tissue over time and reduce saliva production significantly. If you smoke and you have morning dry mouth, that combination is also putting you at elevated risk for gum disease, tooth decay, and oral infections, because saliva is your mouth's primary defense against bacteria. So, what should you actually do with all of this information? I want to give you something practical and actionable right now, because I never want you to leave this channel without knowing your next step. First, pay attention to the pattern. Is this happening every morning? Is it getting worse? Are there other symptoms alongside it? Fatigue, thirst, headaches, dry eyes, frequent urination? Start noting these things because they paint a picture that your doctor needs to see. Second, see your doctor if this is a persistent issue. Ask for a blood sugar test if you haven't had one recently. Bring up your medications and ask whether any of them could be contributing. Mention if you snore or if you wake up feeling unrefreshed. These are not trivial complaints. A good doctor will take them seriously when you frame them the right way. Third, in the meantime, there are things you can do tonight to give your body more support. Sleeping on your side rather than your back can reduce the likelihood of mouth breathing. Running a humidifier in your bedroom adds moisture to the air your body is working with all night. Staying well hydrated throughout the day, not just guzzling water right before bed, but consistently throughout the day, gives your salivary glands more to work with. Cutting back on alcohol in the evenings, avoiding caffeine after noon, and establishing a calming wind-down routine before sleep all reduce the degree to which your nervous system is running in overdrive while you sleep. There are also saliva substitute products, mouth sprays and gels specifically formulated for dry mouth that can offer some relief while you're addressing the underlying cause. And please, if you have chronic dry mouth, be extra attentive to your oral hygiene. Brush twice a day, floss, and use a fluoride rinse, because low saliva means bacteria have free rein in your mouth all night, and your teeth and gums will pay the price over time. I want to leave you with this. Your body speaks to you every single day. It sends you signals, some loud, some quiet, some that seem so minor you almost dismiss them entirely. Morning dry mouth is one of those quiet signals that most people ignore for years. But the causes behind it, as you've seen today, range from sleep disorders to blood sugar imbalances to autoimmune conditions to the medications sitting right there on your nightstand. None of these are things you want to miss. You deserve to wake up feeling refreshed, hydrated, and well. And the fact that you're here, watching this, paying attention to what your body is telling you, that already puts you miles ahead. If this video gave you something valuable today, please give it a thumbs up. It genuinely helps more people find this information when they need it most. Subscribe to the Dr. Elara Health channel so you never miss a video, and drop a comment below telling me, have you been dealing with morning dry mouth? How long has it been going on? I read every single comment, and I want to hear from you. Take care of yourself. I'll see you in the next one.